And of course, if you're a world traveler yourself, I always say pay attention to kind of what service is provided to you when you get those recommendations, and kind of think about, were there some gaps in what was provided to me? Is there something that would have made that service more comprehensive, would have made me feel more prepared, or would have made it kind of be a one-stop shop? And I think pharmacy definitely has the capability to do that, right? You can come in and you could get all of your product, you could get all of your prescriptions, you could get all of your immunizations in one place. And that's really nice and convenient.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where quality measurement leads to better patient outcomes. This show will be your go-to source for all things related to quality improvement and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. Please note that the topics discussed are based on the information available at the date and time of recording. Information or guidelines are updated periodically, and we will always recommend that our listeners research and review any guidelines that are newly published. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome back to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich, and on today's show, we're going to talk about immunizations. August is National Immunization Month, and it is our continuing topic of focus for this month. We've covered immunizations, what pharmacists and pharmacy technicians can provide in different states, and as well ways to combat vaccine hesitancy and improve vaccine confidence. Today, we're going to talk about the role of pharmacists and what they can do as it relates to travel medicine and for providing travel-related immunizations. Because of the events of the last 16 plus months, there have been various restrictions for travel, especially international travel. But with that starting to change, many patients or consumers may be interested in traveling once again. Therefore, pharmacists and other healthcare providers may soon begin to hear more questions from patients about what they need to be prepared for as they begin their travel, especially those international trips. Now, our guest for today is an expert with travel immunizations and travel medicine. She's also a phenomenal pharmacist, patient advocate, and a world traveler herself. So today's guest is Dr. Jeanine Abrons, Clinical Associate Professor of Pharmacy Practice and Science from the University of Iowa College of Pharmacy. Jeanine, welcome to the Quality Corner Show.
Thank you so much, Nick. I'm excited to be a guest with you on the PQS Quality Corner Show and to get to talk about the amazing field of travel medicine.
Excellent. Well, Jeanine, before we do that, we need to hear about you. Do you mind giving us a quick background on yourself, your role in healthcare, and what you do now as a pharmacist?
Absolutely. So primarily, I teach and direct programs at the University of Iowa focused on underserved care and global health. I'm also now involved in diversity, equity, and inclusion efforts, service and leadership development, and I'm a writer and editor for publications like The Peripheral Brain for the Pharmacist, which has some travel medicine content. And right now I'm getting ready to welcome our next class of pharmacy students and getting ready to teach travel medicine and global health as the semester progresses. So I'm excited. I'm also excited to continue my non-traditional immunization clinics and COVID clinics as part of the vaccine campaign that's going on right now.
Excellent. Well, thank you, Jeanine. And before we start for today's questions, let's hear the breakdown.
Now it's time for the breakdown. As Quality Corner show host, Nick will ask 3 main topic questions. Our guests will have a chance to respond, and there will be some discussion to summarize the key points. This process will repeat for the second and third questions, which will wrap up the primary content for this recording. After that, expect to end on a closing summary, usually containing a bonus question. Now that we have described the process, let's jump into the questions.
Pharmacist Letter is offering CE credit for this podcast. Please log into your Pharmacist Letter account and look for the title of this podcast and the list of available CE courses. For this podcast episode, I, Nicholas Dorich, and our guest, Dr. Jeanine Abrons, do not have any disclosures to announce for the purposes of CE accreditation. Jeanine, I'd like to begin at the beginning and for us to define the why we are covering this topic. And rather than having me read some dictionary definitions of travel medicine and travel immunizations, I'd prefer to let the expert lead us off. So here's the question for you to get us started. How is travel medicine defined, and what type of healthcare services does this include?
Yeah, absolutely. I would start by saying travel medicine is highly dynamic in a specialty, focusing on the global needs of the community. And you're trying to give pre-travel preventative healthcare primarily. So oftentimes you're going to work with a patient to do a comprehensive risk assessment for the traveler or for groups of travelers. And you're evaluating their past medical history, their medications, their itinerary, destination specifics, in order to help you best advise them on the most appropriate risk management interventions that can make it so their trip is healthy and that they don't have adverse outcomes that come up. So it's really focused on personalization, and that includes the vaccination component, looking at their history, looking at the amount of time available before they depart, and then giving them tools so that they know how to manage the unknowns that might happen during travel, right? The unexpected events that we have, whether it be putting together self-kits for care or looking for different clinics abroad if something more serious occurs.
All right, Jeanine, I've got a couple of immediate follow-up questions as it relates to this topic. So the first thing you mentioned is that really it comes down to doing a risk assessment for this group or individual or group of travelers, especially if they're going to be going internationally. So first question is, when you're doing this type of assessment, what's your source? Like if someone is going to some location, say Malaysia, for their travel, where do you reference to identify what they need to be prepared for versus if they're going to, let's say, South Africa, because those two countries and what may be at risk for them can be very different. So how do you find that information to develop that risk assessment?
So the CDC Travelers Health Site is one of the best go-to references, and it can make and create for you based on drop-down menus. You specify the type of traveler that you're working with, you specify the destination, the accommodations, and then it gives you some recommendations for self-care kits. It also gives you recommendations for the immunizations, and it tries to, as best as it can, prioritize what is essential and what is maybe more optional. And then your role is to help that traveler look at, how do you get all of those immunizations? Do they want to pursue all of the immunizations that are there? What does that picture look like? So the CDC Travelers Health Site is absolutely amazing. And then I find myself supplementing with different resources from countries, from other health entities, just to learn more about the destinations, to try to get an idea of what that person's risk really is and how necessary each one of those components are.
Okay, and then my other follow-up question that I had to this, especially if a patient is going to be needing or requiring immunizations, they need to get that immunization, right? And it needs to be able to build that immune response. So there may be, showing up a day before you travel is not sufficient.
Correct.
When does that assessment need to start?
So, I mean, ideally, if you do this months and months out, it's the best scenario, right? Because we all know that with immunizations, there are series that take time to complete. So ideally, a patient initiates that long before they travel. However, even in our travel medicine class that I teach with Dr. Benz, we have scenarios where we have last minute travelers. So in some cases, with some of the medications and the immunizations, there are catch-up doses that you can give, or an accelerated schedule that you can utilize. In other cases, again, we're kind of having that discussion of how much immunity can we get you before you get on that plane, before you go to your destination? And then how do we supplement that with other risk prevention measures that you might be able to take?
Jeanine, we're now going to move on to our second question. And pharmacists have a role to play with travel medicine. And this can most certainly include immunizations, consults, self-care, and perhaps some medications in preparation for travel. What does it take for a pharmacist to get involved with this type of service? Are there any specifics to setting up a travel health clinic? Are there any certifications needed? Or is this something that, any pharmacy can do as long as they're using the appropriate references and additional information that they can provide to patients?
So, Nick, that depends. Last I saw, pharmacists in many states can provide these services as part of collaborative practice agreements. But in certain states, there are specific travel health training requirements, and that is like, I think Alaska, Arkansas, California, Florida, New Mexico, Oregon, Rhode Island, and South Carolina. So you really need to kind of look at your state's pharmacy laws first and see what are their requirements as far as providing vaccinations and travel health services. To your question about certifications, the American Pharmacists Association has a great pharmacy-based travel health services certification training program that's typically offered at annual meeting, and you can go. There's some pre-course work that you have to do, and then a live component to that. Kind of the gold standard in the travel medical field is the Certificate of Travel Medicine from the International Society of Travel Medicine. I'm a member of that organization, and I'm going to hopefully later this year be able to complete that Certificate of Knowledge, and that is a CTM. And then again, just taking initiative to stay up to date on what are the travel immunizations, staying familiarized with the CDC, Travelers Health site, the ISTM site, the International Society for Travel Medicine, knowing resources like the Smart Traveler Enrollment Program, or STEP, that's offered through the State Department, and then learning about things like the International Association for Medical Assistance, or there's actually a joint commission for international accredited organizations. I think you can do your research and kind of start learning about some of those things. And of course, if you're a world traveler yourself, I always say pay attention to kind of what services provided to you when you get those recommendations, and kind of think about, were there some gaps in what was provided to me? Is there's something that would have made that service more comprehensive, would have made me feel more prepared, or would have made it kind of be a one-stop shop? And I think pharmacy definitely has the capability to do that, right? You can come in and you could get all of your products, you could get all of your prescriptions, you could get all of your immunizations in one place. And that's really nice and convenient.
For the pharmacy, or for the pharmacist, Jeanine, is there currently any service for doing this type of consult? Obviously, if they're doing an immunization, right, you're billing for the immunization, that part gets covered. But for something that's, doing this review, is this something where a health plan would cover it, or, employer would cover it? Or is this something where it's, patients paying out of pocket, or pharmacy maybe providing this service for free?
So most people that I know that provide this service charge a fee for the time that you're doing it. So fee for service. And when they do that, I think part of the way to minimize the time that you're having to spend doing all this data collection is having a great kind of patient assessment tool that you provide the patient first. So, sending home the patient with a worksheet that asks them some specific questions about their health background and their traveler's health so that you can really prioritize and maximize the time that you're spending with that patient.
Thanks for that additional information, Jeanine. It's important to recognize, right? Because if a pharmacy or a pharmacist is looking to expand this service, it's an expectation for the patients that yes, this is valuable time. This is this is the pharmacist using their knowledge and assessing that patient, and that's certainly what we like to see.
And Nick, I will also say that NCPA has a ton of great sample resources. So you can go there and you can see workflow documents. You can see some examples of protocols and other things that, if you're not sure what that data collection tool looks like or how to set this up or how to provide this service, you can go there and you can find these examples for you.
Great recommendation, and thanks for shouting that out, Jeanine. Well, we're now going to move to our third question. We're going to talk about what can happen moving forward. There's a bit of a new concept labeled as wellness travel, and I will admit this was not my idea. This was actually something that you presented to us when we reached out to you about the podcast. And so I was, hey, this sounds interesting. This is new. Let's hear more about it and let's share with our audience. So what can you tell us about this topic of wellness travel? And of course, how does it apply to pharmacist and pharmacy?
Yeah. So wellness travel is really supposed to be focused on helping a traveler take a trip that maintains, enhances, or even can kickstart healthy lifestyles and supporting and increasing kind of our health and our well-being. And that's been historically driven by two types of travelers. One, the people that are savvy and wellness minded. They're seeking out destinations and accommodations and experiences that allow them to be fit, to be healthy, to explore their personal health. And then that's also driven by, again, an expansion of kind of just different offerings by the tourism industry. So it's kind of a shift from this focus of in tourism, they call it sun, sand, and sea experiences, where you're maybe overindulging and you're living it up, to really how can you travel so that when you travel and you come home, you feel restored and not necessarily needing a vacation from your vacation is how I like to say it. So I think that a pharmacist can be knowledgeable about just kind of integrative health in general and different concepts that would help somebody to travel and to achieve that mission. You can be familiar with different destinations and different travel services that are available in other countries. And you can kind of help that person to map out a plan for their travel, right? Of what is feasible, what is possible, what are things that, might not help me maintain my mental health when I'm traveling, or what are my priorities and how do I map this out? So I do know a former student actually who has a travel company as well. And I think that is, kind of a nice collaboration, right? To be able to refer people back and forth and to suggest those different things. And my colleague at Royal Mount University in Canada, Laura L., who's not a pharmacist, she's really been great in helping me to learn more about this concept and expand my knowledge too.
Jeanine, I'll use myself as an example here because when I'm typically traveling and if I'm going for an extended period of time on vacation, there's a lot of indulgence in food, perhaps beverages that are not necessarily healthy for me. So it's you come back from that vacation, that PTO time, and oh, hey, again, my personal example, I've put on 8 pounds in a week, something like that. And when I try to get back into my normal routine, my normal workouts, it's very different. So it sounds like this concept of wellness travel is really both a physical wellness, but also a mental wellness aspect of how do we travel smarter so that we're able to keep ourselves mentally sharp, mentally refreshed so that that time off is truly time off, but also so that the time off doesn't have a negative effect on our body. So is that kind of the correct application for how this works?
That's absolutely how it is, Nick. And obviously, the idea isn't that you're going to go on a trip and you're not going to have some indulgences, right? That's part of the vacation experience, but it's helping you to have a greater balance in that. So it is more restorative, as opposed to just making you come back unwell.
Understood.
So great summary.
Yeah. Well, I'm going to have to think about this for my future travel and have some application. I appreciate that. Well, Jeanine, you have my sincere appreciation for joining the show today and for discussing travel medicine, travel immunizations, and how this can be applying from a pharmacist service standpoint. Over the years, I've seen many pharmacies, and I've seen more and more pharmacies specifically advertising and promoting that they offer these services. The obvious example is with immunizations, as more and more pharmacies are able to provide immunizations and for different age groups for a variety of expanded immunizations. But I've also heard stories from people that they've realized that they need to receive these last minute immunizations or medications prior to travel for somewhat emergency situations, right? And more often than not, a pharmacy or finding a local pharmacy that offers these services often becomes the thing that saves their trip. Is trying to schedule an appointment for a doctor's office or for some other provider may be a bit more difficult. So this is absolutely an opportunity where pharmacy can pivot as a business or as an industry. Pharmacists can pivot as healthcare providers to utilize their knowledge and skills to be a service to their local community, and I guess as well to the international community. Now, as we mentioned at the beginning of the episode, travel opportunities means more patients will focus on how to safely prepare for their international travel once again. So a lot of great food for thought. Now, Jeanine, before we do go, we're reaching the end of our podcast, and we always include a fun or unique question for our guest. And while we've made a bit of a habit asking our guests about their best travel spots and unique pharmacies they've visited, I'd like to approach a bit of a different question for you. And I know your experience your unique experience working with rural health and international health programs. Can you tell us a bit about some of the programs that you've been involved with, particularly with students and some of the international community? What's that like? What's your travel like? And of course, would like to hear a little bit of your service experience with Dominica.
Yeah, so I would say that my interest in travel health stemmed from going on trips and recognizing moments that my students or myself could be better prepared for that travel. So certainly, learning from your own missteps at different times as well. My primary international site that I work with is Dominica, and I collaborate with a combination of individuals. I work with Jungle Bay, Dominica, a local private pharmacy, Jolly's Pharmacy, and then also the Ministry of Health. And in recent years, we've started providing more additional wellness services and implementing things like continuing education. We actually have kind of a remote travel clinic that is within that pharmacy or within that eco tourist location. And then we continue to think about how do we provide more services to patients so that when our students go, we're being more comprehensive in our approaches, and we really are recognizing that we're a global community. So I think in this moment in time in COVID, we've tried to take a step to say, how do we advance what we're doing? How do we make travel safer and healthier for everybody? And for us, that's been combining things like integrative medicine, wellness medicine, and travel medicine together. And we're really excited by some of the things that are coming up and excited to share and grow these programs together. I've also had experiences in places like India and Japan. And I think I'm over 18 countries that I've traveled to, in my past experience. Laura's got me beat. She's at 40. But certainly, again, travel is a teacher in itself. And I think that provides you great opportunities for just reflective practices and learning more about what you can do in your own health.
Thanks, Jeanine, for that answer. And I really commend you for the service. It's something that is very selfless. It's a part of why I think a lot of us go into pharmacy wanting to help people. And I'll point out one item in your response, you mentioned with Dominica, the Ministry of Health, with that. And I hear a number of countries that use that term for their Ministry of Health. And I always laugh because it makes me think it's like something out of Harry Potter. And it's something that we, I think, take for granted. A lot of these medications and treatments that to us, we may take for granted that may just be very commonplace, but for some of these other countries or for some of these other locations, these can be, life-saving, life-changing medications for the people that are there. It is a very different world for them. So it's really, again, I really commend you and those that you've worked with for that service, not just for your local communities, but also for the international community. Something to be commended. Now, Jeanine, any final comments on that?
Yeah, I would just say I also learned so much from my partners. I recognize that as much as we give, we receive back. And particularly when it relates to natural medicine, integrative health, pharmacognosy, just different health approaches, right? And ideas for managing care. I grow and I learn every trip that I take. Working with those individuals too. So I'm super grateful that they're my partners and that they're willing to allow me to come and have those discussions and collaborations.
Absolutely. Well, Jeanine, before we actually close today's episode, I do want to make sure we get final shout out from you. And if anybody wants to contact you, they may have questions about your experience specifically with Dominica. They may have questions on the travel medicine component. They may have questions on the wellness medicine component. What's the best way for them to contact you?
Yeah, Nick, I love for people to reach out, and I'm always interested in growing future collaborations and travel health and global services. You can always email me at Jeanine-Abrons at uiowa.edu, or you can look me up on LinkedIn and would love to connect with you there as well.
Excellent. Well, thank you, Jeanine, for that. And I've known Jeanine for a number of years. And when we were planning for this podcast episode, we wanted to cover travel medicine. I knew she'd be the perfect guest. I knew we would be at risk of having a podcast episode that goes way too long because Jeanine and I could talk about this all day. But one thing I would say for Jeanine, if you do have questions, certainly reach out. She is a great advocate, patient advocate, pharmacy advocate, and she's going to be very helpful. Jeanine, hopefully that doesn't give you too much work or follow-up that's there, but we do want a little follow-up for you, right?
That's okay. I love it.
Excellent. Well, Jeanine, again, thank you for joining today's episode, and that does now wrap up our content for today. For our listeners, make sure you subscribe to our podcast, and if you have a question or topic, please let us know. If you have a topic you'd like to introduce, or if you would like to come on the show, we would also love that. You can DM us directly on Twitter at Pharmacy Quality, or you can email us at info@pharmacyquality.com. With that, I appreciate you, the listener of the Quality Corner Show, and there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.